This is a See Jason podcast, and I am Jason George, a second-year nephrology fellow from Geisinger Medical Center in Danville, Pennsylvania. I am here today to discuss our paper entitled Risk Factors and Outcomes of Rapid Correction of Severe Hyponatremia. Hyponatremia is one of the most common electrolyte disorders encountered in the hospital. In acute presentations, severe hyponatremia can cause neurological complications, including cerebral edema and death. Avoidance of rapid correction of hyponatremia is recommended as it can potentially lead to osmotic demyelination. To better understand risk factors of rapid sodium correction and osmotic demyelination, we conducted a retrospective cohort study of patients who presented with serum sodium less than 120 milliequivalents per liter to 7 hospitals in a large integrated health system in northeast and central Pennsylvania. Rapid correction was defined as an increase in serum sodium greater than 8 milliequivalents per liter at 24 hours. Osmotic demyelination was determined by manual chart review of all brain MRI reports completed after admission. Out of a total of 1,490 patients with serum sodium less than 120 milliequivalents per liter on admission, 41% experienced rapid correction. Patients were more likely to experience rapid correction if they were younger, female, had schizophrenia, presented to a non-academic hospital, had a lower serum sodium initially, or urine sodium less than 30 milliequivalents per liter. Of the 295 patients who underwent brain MRI during or after admission, 1 patient had osmotic demyelination on presentation, and 8 patients developed incident osmotic demyelination in the hospital. 7 out of these 8 patients with incident osmotic demyelination had a preceding period of rapid correction. Other common features in patients with incident osmotic demyelination included hypovolemia, beer potomania, and hypokalemia. Surprisingly, 5 of the 9 patients with osmotic demyelination had documented evidence of neurologic recovery. In summary, in a cohort of 1,490 patients presenting with severe hyponatremia, rapid correction occurred in 41%. While MRI-confirmed osmotic demyelination was rare, rapid correction occurred in nearly all patients who had evidence of osmotic demyelination, highlighting the importance of judicious sodium correction in such patients.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.